Abby Stalder, and this is my final videotaped head-to-toe assessment for the Nurse Educator Lab 762. So this is my patient Becca that will be helping me out today. So I'll go ahead and get started. So the first thing I would do as I enter a patient's room to assess them is obviously wash my hands first and foremost and introduce myself to the patient. And while the patient and I start conversation, I would kind of do a general survey of that patient, noting her dress, her hygiene, her generalized color, and also her orientation to time and place, as well as her mood and affect. Just all this stuff I can kind of gather from meeting her for the first time. So, hi Becca, how's it going?
It's going good.
Good. And she is oriented to time and place. Her color looks great. She is groomed and dressed appropriately. So kind of moving on and diving into the physical part of the assessment, the first thing I would do is kind of an overview of her skin. And I would note, her color, looking for any cyanosis, the texture, temperature of her skin, looking specifically for any lesions or areas that seem to be a problem or concerning to the patient. Becca does not have any grotesque lesions, but for the sake of this assessment, we'll go ahead and say that she has a lesion on her shoulder. And it's about 2 centimeters. It's brown-black. The consistency is kind of grainy on the top or wart-like. It's got an irregular border, and she denies that it's giving her any tenderness or pain. But because of how it looks, it would warrant further evaluation. So next, in regards to we move on to her head. And the first thing that we're going to look at on her head is her scalp, and make sure that she doesn't have any abnormalities in skin, as well as any kind of bony abnormalities in her skull. And we also note the texture, distribution, and quality and quantity of her hair, which everything on her scalp looks great. Becca, is there any places on your scalp that are causing tenderness, pain to you whatsoever? Perfect. So we would evaluate the scalp, make sure that there is no, obviously, lesions, tenderness, kind of note all of that, the quality of her skin. And then we kind of move on to her neck region. And a couple things that we want to check on her neck. One is we want to make sure that her trachea is midline and that there's no deviation in her trachea, as well as go ahead and just kind of palpate it for any tenderness, masses, lesions. The other thing that we would want to feel, if we're able to, you can't always feel it, is the thyroid gland. Checking both the isthmus and the lobes of the thyroid for any tenderness, mass, or lesions. So Becca, is there anything tender there at all?
Nope.
Perfect. And then we would want to go ahead and test a couple muscles that are involved with her neck. So one is doing the shoulder shrug resistance test. So Becca, go ahead and shrug against my shoulders. Perfect. And then we also want to note her sternocleidomastoid strength. So go ahead and push. I'm going to turn your head this way and push against my hand. I'm going to turn your head this way, push against my hand. Perfect. So she's got normal muscle strength in those muscles. Then we move on to her actual beautiful face and check her facial expression. One of the first things we notice when we walk in, looking for any drooping, any asymmetry. So Becca, go ahead and smile, raise your eyebrows, and grimace for me. Perfect. She's got symmetrical movement. And then there's a couple things that we want to go ahead and palpate on her face, just to make sure that they're functioning correctly. And one is her temporomandibular joint. So this is what opens and closes her jaw. So Becca, go ahead and open this, close it. And we want to be feeling any tenderness, hurting when you do that, any popping that you've experienced?
Nope.
Okay, perfect. And hers feels great in working function. We'd want to check for crepitus, any popping noises, and especially any distress to the patient. The other thing that I'm going to go ahead and check on her face is the muscles that she uses to chew, which are her temporal masseter muscles. So I'm going to go ahead and feel on her temporal, like right where her temple is. And Becca, go ahead and clench your jaw for me. Perfect. And I can feel those muscles working. I'd ask if there was any tenderness, any pain associated with chewing. And then I'm going to go ahead and just palpate her face looking for any pain, any loss of sensation. So Becca, can you feel all this okay?
Yep.
Any pain associated with that?
Nope.
Perfect. And then another part of her head and neck that is critical to assess is her lymph nodes. And there is quite a few lymph nodes in this region. So in front of her ears, I'd want to feel for the pre-auricular lymph nodes, behind for her posterior auricular lymph nodes. I'd also want to feel for her occipital nodes if I could, her tonsillar nodes, her superficial cervical, posterior cervical, and deep cervical nodes, her submandible nodes, her submental nodes, and then both her supraclavicular and infraclavicular lymph nodes. Palpating for all those, I didn't feel any inflammation or tenderness. Becca, have you had any sensation of tenderness?
No.
If there was, that would kind of indicate to me either an infectious process or a pathology. So that kind of concludes the structures of the head and neck. But now we're going to move on to kind of what Becca uses with all of her senses. So the first thing that we're going to check is her eyes. What we would start by doing is, I always like to start with a Snellen eye chart to check visual acuity. So having her look at a chart and read off letters both with and without her glasses, just to kind of see what her vision is. And then there's some other tests that we can do to kind of check her overall visual fields, as well as her reflexes to light and whatnot. So the first one we're going to do is what we call the confrontation or the wiggle test. So Becca's going to look straight into my eyes. And I want you to tell me, Becca, when my two fingers come into your vision, okay? So go ahead and tell me when you see them.
Yep.
Tell me when you see them.
Yep. Yep. Yep.
Perfect. If she had any loss in visual field, you imagine kind of a glass bowl around the patient's head, and where the fingers would come in would be much closer, indicating some kind of pathology. So the next thing that we're going to go ahead and do is check Becca's corneal reflex and reflection. And what that will indicate is if she has a shadow when I pass that light, that's sometimes indicative of glaucoma. So one thing I want to check is just moving my light towards both of her eyes laterally, making sure that we don't have that shadow. Perfect. And then the other thing that I was checking when I was doing that is her corneal reflex. And what that means, or her corneal reflection, excuse me. What that means is that there should be actually a reflection of my light on the medial side of her pupil that indicates that she's reflecting and focusing correctly. And both of those were beautifully normal. The next thing that we're going to do is the 6 kind of cardinal directions of gaze to test her extraocular eye movement. So Becca, what I want you to do is only with your eyes, go ahead and follow my pen light, okay? Perfect. And what I'm looking for in that is any nystagmus or kind of jerking of the eyes as they move through those directions. Also, her moving her head to see them would indicate maybe some loss in a visual field. With that being said, then the next thing I would do, and for the sake of this assessment and my lack of tools, this spoon is going to serve as several tools to me. It's first going to be my ophthalmoscope. So what I need to do next is look at Becca's, the back structures of her eye, looking at her retina, her optic disc, her retinal background, and her retinal arteries and veins to ensure that she doesn't have any papilloedema, any signs of glaucoma, any abnormality. This would especially be important in somebody that has diabetes or hypertension. So Becca, I'm going to go ahead and pretend that I'm looking in your eyes at your optic disc, optic nerve, macula. Everything looks beautiful, everything looks normal. So that would be part of my assessment as well. And then next, kind of most importantly, is the structures of her eye. Yes, we can test all these reflexes, but we need to make sure that the actual structures are working correctly. So Becca, I want you to go ahead, close your eyes, and then go ahead and try to open your eyes against my fingers. She has good lid resistance, so her lids are working correctly and they're in symmetry with each other. And then I want to check her eyebrows for any abnormality, her eyelashes, her conjunctiva, her puncta, her papular fissure, look at her corneas, and everything looks beautiful and normal on her. So that kind of concludes the eyes. The next thing that we're going to look at on Becca on her head structures is her ears. And what we want to look at is the position and just kind of overall look of her auricle, or the external structures of her eyes, of her ears. Still on the eyes. And then next we want to go ahead, and this is going to also be my otoscope, and I'm going to actually look in her ear at her tympanic membrane and auditory canal and look at the integrity of her tympanic membrane. Is there any fluid behind it? Does it have a reflection? Can I see her umbo and the handle of her malleus? Yes, I can. That's all beautifully normal. And I would check this on both ears, looking at the auricle and looking at her tympanic membrane, noting any fluid behind it, the reflection, the color. Everything looks good. No fluid, which could indicate some kind of ear infection or fluid behind the ear. Everything looks perfect. So that kind of concludes the ear. Next, we're going to move on to her nose. So I kind of want to look at all structures of her nose, the bridge of her nose, look at her septum, and go ahead and make sure that both nostrils are patent. So Becca, can you go ahead and plug each nostril and kind of blow out for me? Perfect. Both of her nostrils sound very patent. And then we're going to go ahead and pretend that my pen light is an otoscope as well, and kind of look up her nose and look at the quality of her mucous membranes, her nasal mucosa, her turbinates. Notice that her septum is not deviated, or there's no holes in her septum in any way, and just kind of make sure that everything's going okay up there. She's got pink mucosa, no nasal drainage. Everything looks great. The other thing that I want to check in regards to her nose and goes along with the face is her sinuses, her facial sinuses. So I'm going to go ahead and palpate right here. Becca, is there any tenderness there?
Nope.
Perfect. If there was, I could trans-illuminate the sinuses. The sinuses should be transparent, but if they're not, that could be indicative of some fluid buildup in the sinuses. So next we will move on to Becca's mouth and pharynx. And this is kind of, you can assess both of these at the same time. So Becca, go ahead and open up your mouth for me. And I'm looking at her buccal mucosa, her teeth, her tongue, the ventrum and the dorsum of her tongue. So Becca, go ahead and flip your tongue up, looking for any abnormalities under her tongue. She's got excellent tongue strength and movement. And then go ahead and open again for me. And I'm looking at her tonsils. Her hard and soft palate look great. They're intact. They move symmetrically. And then her uvula is midline. There's no redness in her pharynx. And her tonsils are probably, I would grade them at 0. They're pink, normal, no enlargement whatsoever. Becca, go ahead and try to swallow for me. Yep, I can see her swallow reflex. And because I'm going to be nice to Becca and she's helping me with this assignment, I'm not going to test her gag reflex, but how I would do so is sticking a tongue depressor in the back of her throat and kind of eliciting that reflex. And for our intents and purposes, we'll say that's intact. So next, we will move on to assessing Becca's lungs. And how we do that is both an anterior and a posterior assessment of her lungs. First and foremost, palpation. So I'm just going to kind of feel along her lung bases here, asking her if she's feeling any tenderness, if I feel any masses, any problems that she's had breathing. Becca, do you feel anything abnormal?
Nope.
Perfect. The next thing that I'm going to kind of do is kind of notice, just purely based on me assessing her in the overall general survey, what her rate, rhythm, depth of breathing is. And she's sitting here at ease, no accessory muscle usage or increased effort with respiration. She's based on her vital signs that I took at the beginning of this assessment, she's breathing at 18 beats per minute, normal rate, normal rhythm, everything looks great. I'm going to check for anterior tactile fremitus, which is where I'm going to grab her right here. And Becca, go ahead and say the words 99 for me.
99.
That was perfect. If she had fluid buildup or a tumor, that vibratory sense of that tactile fremitus would increase, telling me that there's some kind of abnormality in her lungs. And then we will go ahead and auscultate her front lungs. So I'm